This presentation is for the Maternal and Child Health Bureau of Maryland Department of Health. It's adapting evidence-based interventions to prevent teen and adolescent suicide in Maryland. Suicide as a public health issue, it's a serious issue. Over the years. There has been an increase in the rate of suicide among teenagers. Suicide is defined as the act of taking one's life intentionally. It takes a tremendous emotional toil on the victims, on their families, friends, and the society at large. It's the 10th leading cause of death overall in the U.S. Among ages 10 to 14, it's the 3rd leading cause of death. Among ages 15 to 24, it is the 2nd leading cause of death. Annually, it costs the U.S. government $51 billion to take care of suicide. This graph shows an increase from 2007 to 2014. Over a 7-year period, there has been the rate has increased by more than twice that what it was in 2007. And this graph shows us the general graph for all the 50 states in the United States. We see here that Maryland, though there has been, Maryland has a low rate of suicide among the 15 to 19-year-old, but nevertheless there is an increase, and we should not take it for granted. This graph also shows here the suicide rate by race, ethnicity, and gender. American Alaskan, both male and female, have the highest rates, followed by non-Hispanic whites for ages 18 to 24. And for ages 15 to 19, it's the same. It's still American Indians, both male and females, followed by non-Hispanic whites. There are social determinants that play a huge role in risk factors of suicidal behavior. If there is no money, it prevents access to mental health care to treat mental disorders. Also, lack of resources in terms of adequate mental health care services. Availability of those mental health care services also are risk factors in suicidal behaviors. Here we have a social ecological model. This model represents suicide prevention at each level. The individual, how does the individual relate to this attitude? The interpersonal, where you have the family support, social network, organizations, that is your school, because we are dealing with teens and adolescents, religious bodies, other community organizations, not for-profit organizations that have programs for suicide prevention, the community collaborating, coming together, and then policies that enact employing mental health care providers in schools, that also enact providing funding for training for surveillance. This table here, we used it to understand the issue at each level, and what helps and what hurts the issue at each level that is being examined. And we looked into references, reputable references as guides to give us shed light on the factors that influence adolescent and teen suicide. So after going through that table, developing that table, we now looked into evidence-based suicide prevention interventions, and we picked up 3 that are easily adaptable to our target audience, which is teen and adolescents. One is Empowering Our Spirits initiative. Another one is Surveillance of Suicide and Self-Harm Among Teens. and collaborative assessment management of suicidality. In Empowering Our Spirits initiative, it takes into cognizance the interpersonal and individual level, and also the organizational level of the social ecological model in providing support, family support for the victims, having caseworkers working alongside family members to boost self-image in victims. Our surveillance of suicide and self-harm among teens and adolescents employs the policy level of the model in training suicide prevention coordinators in tracking, reporting, and documentation of suicide events, and also developing training, suicide prevention training programs to be presented to schools. It also involves the community level, in which there's a collaboration with schools and the government in providing suicide prevention programs. And then our collaborative assessment management takes into consideration the organizational, the individual, and the interpersonal relationship levels in which the healthcare provider and the victim during sessions assess and identify the risk factors of the patient, and you have specific suicide treatment plans developed accordingly. So the goal of these evaluation is to reduce suicide rate among teens and adolescents over the next 10 years. We will be collecting data pre-intervention, during the intervention, and after intervention, and we will be analyzing these data, comparing the rates, just like the one we had for suicide rate in 2009 compared with suicide rate in 2014, state by state. We will be doing that comparison. We would look at for our improved system over the next over the next 10 years, a 75% improvement in promptness of reporting events. We will be comparing how prompt the events are being reported. Is it being reported within an hour, 2 hours? Over time, we will also be comparing the consistencies. Is there a consistency in definitions of suicide and self-harm across all borders, and are these interventions meeting the needs of victims? Empowering Our Spirit initiative, we want to see an 80% change in family and teen behavior after the suicide attempt. So we will be asking questions. We would have questionnaires to collect information about how the teens and their families are responding to the sessions, and how progress is going on. And also the collaborative assessment management, we want to the target is that our treatment plan that is developed is specific and it's effective, and during sessions we would obtain information on how the patient's outlook to life is changing after the intervention, and also there would be monitoring over a period of 10 years to see maintenance of positive attitude. So these are our challenges. What are our solutions to the challenges? We will be using current, accurate, and adequate data. From time to time, we will be presenting our findings. And also, we are going to engage community in developing home-based initiatives. All our tracking equipment, reporting equipment have to be updated, and personnel has to be trained. This is a logical model, showing the relationship at each level, our resources, our activities, our outputs, and what we hope to achieve. So I have come to the end of this presentation. If there are any questions, please feel free to contempt.